Welcome back to the Lovin Dubai show. We're now joined by one of the doctors from Al Tawadi Specialty Hospital who's taken part in a very rare surgical procedure where they managed to successfully remove a 4.4 kg tumor from a patient's body. Welcome to the show, Dr. Kacarska.
Thank you for the invitation. It's a pleasure sitting with you.
It's a pleasure to have you on the show. First of all, a massive congratulations on the achievement. Can you tell us a little bit about the background to the surgery? How rare is a tumor of this size?
To be honest, this is a very interesting story. The case was referred by my colleague from our peripheral clinics. So he said, Dr. Anna, we have a very difficult case, special case. There is one tumor in the abdomen that I revealed, so I will refer the patient to you. And I said, okay, you're more than welcome. We will see the patient together. So what we found was a very huge intra-abdominal mass that I have never seen so big mass till now, to be honest, in my experience. What is also very challenging is that the woman, this girl, has never been married, no children, and everything. So the biggest challenge was actually to preserve the uterus and her fertility abilities for the pregnancy in the future. So we made a good assessment. We made all our preoperative evaluation. We prepared ourselves and as a team. So we did one consilium of doctors, me, Dr. Gautam Lahiri, our general surgeon, and Dr. Adel Khalil, our consultant urologist. So we did a lot of examinations. We found that there is a huge intra-abdominal mass.
This is the tumor, is the
tumor, yes.
Okay.
So with weight like 4.4 kilograms and like a 30 centimeter diameter. So it was a really challenging case. So we made a good plan because we found that this tumor is making a compression of the left ureter. So we need our consultant to do the stenting of the ureter for easier approaching of the tumor. So firstly, what we did the stenting of the ureter. Then we proceed with our general surgeon by removing this huge tumor and then to remove the other tumors and reconstruct the uterus and to preserve all the organs. Yeah.
Can we take a little step back? How did she become aware of this tumor?
She knew that she had something in her stomach that is that is abnormal, and she thought first that she's gaining weight. And she said, that she felt some intra-abdominal masses, and she went to her doctor, to Dr. Hamad Mohammed, in his clinic, just for a general checkup. So by this time, what's the tumor revealed?
So we know that the size of this tumor is very rare. You said it's the largest you've ever seen in your career. How regular is it for a woman or a man to discover something like this inside them? Is it cancerous or?
It is not cancerous lesion, but it is very rare to be found. Even when I spoke with my colleagues, even if you want to operate another case like this, it's very, very rare to be found or known to be operated. So it is a very first big surgery in our hospital because we are new in the market, but also it is very rare as a case to be seen and to be done in the other hospitals also as well.
You mentioned there you removed the tumor. Did you say the other tumors?
Yeah, there is also another tumor inside the uterus. So we removed also this kind of tumor, which was 5-6 centimeters also in the wall of the uterus. So we opened the uterus, we removed the tumor, we reconstructed the uterus in order for childbearing, and yes, this was very impressive at the end of the surgery. We were very happy and satisfied.
Amazing. So in terms of the patient, how is she now?
She's more than perfect. I said, you are more energized and more healthy than me. I told her yes, and she's also very happy because she doesn't have this discomfort anymore. She doesn't feel this discomfort, so she's very happy and satisfied.
Well, it's a massive awareness piece to the rest of us. If you feel any sort of discomfort, you go to the doctors and you get it checked. Are there any kind of lifestyle implications pre-surgery? Is it genetic, this tumor? Was the tumor genetic, or was it a lifestyle, or how did it develop to such a size?
Yeah, this is a very frequent question that people are asking me, even my friends. I said
everyone wants to know.
Yeah.
It's like, is this something that we can prevent, or was this just really, really unfortunate?
I think that the most important actually for women and for women's health is to do regular checkups, to visit regularly their gynecologists, because most in 21st century, most of the diseases can be prevented, and the diseases are preventable. So the regular checkups is something that all women should prefer. So this tumor, there are no specific theories about this tumor that this kind of it is genetic disorder. It is known that it's hormonally active tumor, that the estrogen and progesterone receptors are included in this kind of tumors. But still, I will recommend to all women in the future to visit their gynecologists and to do regular checkups in order anything that is abnormal to be seen and to be prevented in the early stages, not to be like 4.4 kilograms.
Okay, well, a massive congratulations to your team. Is it this is your job, I understand that. How nerve-wracking is it pre-surgery when you're dealing with something that's quite rare?
We love our jobs. We are happy when we are in the OT room. So it's not nerves-wracking. Actually, it's a feeling that you want to help to the patients. You want to solve their problems, to see them after the surgery happy with their family. So it's
so nice to hear.
Yes, it's not nervous-wracking. It's relaxing actually for us, the surgeons. Yeah, we are more relaxed in the OT. We love our jobs.
Amazing to hear.
Yes.
What does this achievement mean for the medical world in Dubai?
It is, firstly, it was a big achievement for us because the hospital is a brand new hospital. We are new in the market, Tadawi hospital, but the management in the hospital is perfect. I think their support was also very important for us, for the surgeons. Very big thanks to Managing Director, Mr. Marwan, to our also CEO, Dr. Haidar Al-Zubaidi, and I want also to thank my HR director, Ms. Fatima. She was my biggest support in this hospital. So I think that all people are important for this case, for their support and everything that they did for us as surgeons.
Look, it's so fabulous to hear that your patient is doing well now. I think everyone is breathing a sigh of relief when we kind of heard the start of the story. And also just congratulations to you and your team. And I think it's a massive reminder to us ladies to get checked. It's so important. And like you said, if we check things early, we could kind of reduce the need for this rare surgery.
Yeah, true.
Okay. That's everything. Thank you so much for your time this morning.
Thank you for the invitation again.
Guys, that is it for us on the Lovin Dubai show. That was Dr. Kacarska, and we will see you tomorrow morning, same time, same place. Stay safe and wash your hands. Bye-bye.